12 healthcare workers from the Health Ministry and 3 others from the private hospital sector have been infected with COVID-19. Health Director General Datuk Dr. Noor Hisham Abdullah on Friday said one of the 12 ministry workers is on ventilatory support in the intensive care unit. He said the virus knows no boundaries and described the frontline medical workers' battle against the virus as a war. He emphasized other healthcare workers' message to the public: please help us to help you. Stay at home.
Assalamualaikum and hi everyone. My name is Fatim Farhana and my group members Siti Nur Safina, Madumati and Muhammad Farizul. So from the previous video, we can see the phenomena that happened in our country recently, which is we need to face the pandemic COVID-19. So here we're going to present our case study for quality improvement tools and methods subject, which is Frontliners issue facing on handling pandemic COVID-19. Frontliners that has been chosen for these issues is Ministry of Health Malaysia or KKM. We apply basic and new quality tools to identify the issues and improvement for the problem. Ministry of Health Malaysia or KKM had a problem regarding to drastically cases increase. No public cooperation be the one of the root cause why the number of the cases become high.
On 18 March 2020, Malaysia has been declared to carry out Movement Control Order (MCO) to curb the spread of COVID-19 virus. Until December 2020, there has been 7 phases of MCO conducted, including PKP, PKPB and PKPP. Despite there are still a number of people who did not follow the order and comply with SOP.
The Ministry of Health or KKM need to against this issue to make sure the virus is not spread. Regarding to these issues, many things that people are not alert when they are going out, such as they are not wearing masks, no social distancing, no quarantine, gathering event, and do not do the swab test. We use Pareto chart to identify the issues and we already arranged from the highest number to the least. Before this, we did our interview with Madam Naraini, which is one of KKM staff that been working in Perak. The Pareto principle states that 80% of consequence come from the 20% of the cause. So you can check out the graph. For the way to educate people in living a new norm and having an awareness, we use an FAT diagram. So here we collect all the ideas in this picture and categorize it into this. We categorize it into a few categories, which is social media, government, entrepreneur and family. We move to the next issue. The issue is about Ministry of Health or KKM is having a lack of staff. For these issues, we also got the data from the interview. Ministry of Health Malaysia or KKM do not have enough staff according to the high number of COVID-19 cases. Since the number of cases drastically increased, KKM need to find another staff from other hospitals to fulfill the void to handle the cases. So we use histogram to show and see which cause that make the lack of Ministry of Health or KKM staff during pandemic. So we can see here in the histogram, there are a few causes that make the lack of staff of Ministry of Health Malaysia. The causes are staff affected with COVID-19, increasing cases drastically, staff transferred to high-risk area hospital, give affection to another colleague and staff scared to handle the case. We make and use 3 diagrams to show you the overcome and the suggestion to this issue. So we can see in this picture, the private hospital staff and recruit new staff become 2 main suggestions to help this issue solve. So for another issue, I will invite Siti Nur Safina to continue her explanation.
Assalamualaikum, my name is Safina and I'm from Kota Tinggi. I will present on the issue of insufficient amount of PPE. Personal protective equipment PPE is for frontliners that facing COVID-19 virus. This is widely used by frontliners in curing and facing patients that involved with the virus. The PPE used by the staff are boot cover, head cover, disposable soot-resistant apron, and protective coverall. Due to the increased number of cases, hospitals face a problem with the insufficient PPE stock. In order to identify the problem, quality tools or histogram has been used. The data was collected based on the stock of PPE that available on KKM facilities on 13 April 2020. The data recorded for surgical mask, N95 surgical mask strip-lie, protective head cover, face shield, boot cover, isolation gown, and disposable coverall was transformed in histogram. This will make the data easy to understand and observe. Besides, the solution for the issue has been analysed by using Process Decision Program Chart, PDPC. With the objective to increase the PPE stock, the main activities to achieve the target has been analysed, which are spread to public and encourage production of PPE. The unlikely issue has been crossed and the final countermeasure has been identified. In conclusion, cooperation from various parties is very important to address this problem. Careful planning and steps must be taken to address the problem encountered.
Good evening everyone, my name is Madhumati, daughter of Madiwanan. I'm staying in Selangor Shah Alam, which is currently in a CMCO. So the title of the content is the lack of medical equipment, and the problem statement is on 30th March of this year we have a lack of shortage in a ventilator in the hospital because during that time the government just announced about the MCO, and the frontliners are also panic and they were so fierce about the patients, especially the lungs disease patient to affect and also having a risk on their lives. So for the root cause analysis, the machine for the ventilator it's quite expensive. Usually it will be cost more than 130,000 ringgit Malaysia, and for the USD it will be $30,000. So it's quite expensive. And we also target the person which having a respiratory disease or syndrome on their bodies. To identify the problem, I used Ishikawa, which is fishbone diagram. It is actually a visual aid, easily can see the cause and effect in the problem. And also it will be investigated by using 5 why questions, which is why, what, where, when. So it is very easy us to clarify, and we got the solution from this diagram. So I used this one of the reason to investigate this problem. And next for the improvement activities, I chose on the tree diagram. Tree diagram it is actually give us the solution by solving the critical task by planning in the management tools, and also it also achieve the goal of the whole problem. So then I choose this tree diagram for this problem. Lastly, about the conclusion, actually if we got to know earlier, I think last year December itself we all know about this COVID-19. If Malaysia government, if they have alert on the equipment and the other medical stuffs, we can even have a solution more earlier on this year. I mean in January 2020 itself we can already have enough medical equipments and all the medical stuffs, medicine and all. At least we have a prevention from the worst stage.
Assalamualaikum. My name Muhammad Farizul Hazim Beturin. Today I will explain about what healthcare faced during COVID-19. The title is lack of facilities. For the problem statement, recently on October 10, 2020, Frontliners staff faced difficulties due to the condition of COVID-19 in Kota Kinabalu, Sabah. Is in a worse situation, even more lack of bed in Queen Elizabeth II Hospital to accommodate infected patients, which makes some patients who have mild symptoms had to be quarantined at home because the hospital was not able to fully accommodate patients with COVID-19 infection. For the root cause analysis, the situation was when patients from outside the district also received treatment at Queen Elizabeth II Hospital, which caused a crisis of lack of beds to meet growing needs of COVID-19 patients. Cases are getting worse when politicians hold election in Sabah. Then movement control, that is PKP, was made too late as many had left Semporna to Kota Kinabalu and Peninsula Malaysia. Flowchart to tighten the entry requirements for outsider to Sabah. Then they have to fill out the COVID-19 contingent and assessment screening form. If there are symptoms, they have to immediately refer hospital for further treatment. And if there are no symptoms, people cannot take the issue lightly because it will probably be risking without their knowing. With the head of health workers, people have to give their willing to take COVID-19 screening test and wait for the outcome result, either they have to be quarantined or not. If the result is positive, they will immediately get treatment at consigned hospital. And if it's negative, then don't need to quarantine themselves. Okay, for the conclusion, tightening the Sabah border can further reduce the risk of increased COVID-19 in the state, and if these controls are constantly monitored, the hospital facilities will be adequate for all patients. All political event or special event involve large group should be postponed in advance.
There's 5 issues that faced by Frontliners, which is Ministry of Health Malaysia or KKM, and suggestion for solution by using basic and new QC tools. So that's all from us. Stay safe everyone. Thank you. Bye bye.